Well, hypothyroidism is a condition in which the level of thyroid hormone is lower than it should be.
And when that happens, bodily functions can slow down, including heart and brain function, digestion, energy level, and calorie burn. Underactive thyroid is much more common than overactive thyroid, and it's much more common in women than it is in men. So here are 9 signs that you might have hypothyroidism. Number 1, elevated cholesterol.
Many patients with hypothyroidism have elevated cholesterol. Matter of fact, before cholesterol medications, one of the treatments for hypercholesterolemia or high cholesterol in the blood was thyroid medication, and it works. By giving thyroid medication, people are astounded by how much their cholesterol comes down, and in many cases we're able to completely eliminate the need for anti-cholesterol medications such as statins.
Number 2, poor concentration.
More specifically, something called brain fog, where you have very poor short-term memory. You forget things. You forget where you left your keys, where you parked your car. And this is a very, very common sign. And many people think they have Alzheimer's. Problem is these patients many times are in their 20s, 30s, or 40s, when certainly Alzheimer's is not on the list of possible diagnoses. Therefore, again, testing the thyroid hormone, optimizing, many times will reduce this brain fog and improve memory issues.
Number 3, a hoarse voice.
Many patients with low thyroid retain water, and they can have swelling, including swelling of the vocal cords. Therefore, by treating the thyroid, the swelling is reduced and the hoarseness improves or completely goes away.
Number 4, muscle or joint pain.
They generally have a generalized joint pain that's bilateral. So it's in both knees, both elbows, both shoulders. And it's this type of sensation where you feel it very deep into the bone, but it's not associated with any sort of arthritis. And this is the type of joint pain that can certainly be associated with low thyroid.
Number 5, constipation.
Again, lack of thyroid hormone in the gastrointestinal tract slows down the motility of the colon, leading to constipation. It can be mild or it can be severe. It can be any part of the spectrum.
Number 6, menstrual problems.
Many of my patients who are low in thyroid don't have their cycle, and they can lose their cycle for months at a time before the cycle comes back. This is a very common phenomenon, and by treating the thyroid, we have the cycle come back after 2 or 3 months.
Number 7, increased sensitivity to cold.
When your thyroid is low, there's less blood flow to the cells, and you get a feeling of coldness in the body.
Number 8, dry skin and hair.
The dry skin can occur in patches. It can occur throughout the entire body. The hair loss can be loss from the scalp, from the eyebrows, or it can just manifest as thinning of the hair with minimal or no hair loss.
And finally, number 9, depression.
Many patients with depression are low in thyroid, particularly a type of thyroid hormone called T3, which is the active form. And I have many patients who come in who tell me they have many signs of hypothyroidism. One of them is depression. Many of them are on antidepressive medications before coming to see me. And one of the things I do is ask questions regarding the depression, how long they had it, if they had it roughly the same amount of time as their other symptoms. And of course, test it and treat the patients appropriately and see if their depression improves. If many patients were actually able to lower their antidepressant medications.
And in some cases, completely eliminate it. Now, Dr. Borenstein says these symptoms can range from mild to severe and manifest themselves differently in each patient. So if you have questions, see your doctor for a complete evaluation, including a physical and blood work. From there, a diagnosis can be made and treated appropriately. With Everyday Health, I'm Taryn Brill.